So what you did to start your amputation, that bandage at the very top, that has a bolster in it. It has a big thick lump. And you tie that over an artery, you wrap it around. Then you take your tourniquet, and this is a Pettit screw tourniquet. They were invented in 1718. And you strap it on, and they have a big brass screw that you then tighten that down, and it tightens it even further. And that had the advantage of being very tight, and sometimes even the patient could be instructed to tighten it or loosen it after the fact if there was bleeding involved. So you stopped blood, and then you had to get the skin and muscle opened, and you took that curved knife there, and curved amputating knives go back many thousand years. The Greeks and Romans had those. If you look in museum pictures, you'll find curved knives. And this curve was so that you could reach around the limb, and with one or two swipes, you're through the skin, through the tendons, muscle, down to the bone. The skin then was a little far down. You wanted then to have the skin and muscle pulled way back so that you could cut the bone up high, that when you were done, you had skin and muscle that would help protect the stump. If you just cut where you use the knife, as it's healed, all the stuff retracts, you've got a piece of bone sticking out. It's not a handy thing to have. So once you got down to the bone, you took any one of a number of things to pull back the muscle and skin. This is a little fancy one. These are both muscle retractors. They each have one or two holes and a slit, and if you cut the arm or the lower leg, you had two bones, so you put the retractor on like that. Your assistant pulled back and pulled all that muscle mass and skin way up above on the bone. Then you took your amputating saw, you sawed through it. Now up to this point, when you dropped your limb, for a leg, 3 to 4 minutes. An arm might be half that. At this point, they stopped the timing of it. They didn't time everyone, but it became a point of pride how quickly you amputated, so that your reputation was based on a 2-minute amputation or a 3.5 or whatever. After that, you had a tourniquet on a stump, and you had major arteries in that stump. Wherever it was, you knew what your big arteries were. And so what you had to do is to go for the arteries with this little hook, and you would hook it, pull it out enough to take the wax linen suture, tie a knot around it, and then you were done with that. You could let it go. The other way that they would do this is to take an artery forceps, which usually had a sort of a clamp on it. You pick the artery up, push your lock onto it, tie it the same way, or you could take either one of these with the artery out and take a needle with a suture on it and do a little purse string around where the artery was, pull that in, and that would close it off. Sometimes when you had trouble finding just the right spot, you pull out the artery and some muscle and whatever was around it and try to catch it by doing this purse string around it. At that point, in the 18th century, they were still doing straight or circular amputations. They weren't doing flaps. That was a knowledge that we'd had, for 1,500 years, but didn't do at this point, probably because a flap would close in infection, and they were far less successful than just letting a flap heal itself. So now you have the stump and you have your ties from your suture hanging out. Now those would loosen naturally in about a week. And one of the things you did after an amputation is in about a week, you give a little tug and see if you get the stitches out. Now that was the dangerous time, because sometimes they weren't fully healed and you'd start bleeding. So you had to be ready for bleeding at that point.